Okay, so as said in my interest, I'm a board-certified internist. I'm a primary care doctor. I'm sort of on the faculty at Brown, and I have no disclosures to tell you about. I'm going to briefly talk about what is lifestyle in medicine. I'm going to talk a little bit about how nutrition assists with joint health, although I think Jeff kind of keyed that up pretty well. And then I'm really going to focus my talk on stuff you can actually do practically to help patients make better nutritional choices. So let me start, as many of these talks do, with an actual anecdote about a real patient. Okay, I'm going to call this patient Maria. She is a middle-aged woman I've been taking care of for some time. Very minimal medical history, pretty healthy, but unfortunately, she had to be admitted to the hospital for prolonged antibiotics after developing an abscess. And at our follow-up visit, she complained of diarrhea. So I didn't see her back for a year, and when she came back a year later for her physical, she was still having diarrhea and abdominal pains. And she'd been in this time seeing her gastroenterologist, who I know he's a very competent and thoughtful physician. And he did a very broad workup on her appropriately. So he did blood work, stool studies, a colonoscopy, an endoscopy, a CAT scan, malabsorption studies, motility studies, and great news, he was able to exclude a lot of the scary stuff. So cancer, infection, parasites, pancreatic insufficiency, colitis, Crohn's disease, bacterial overgrowth, celiac, liver disease, motility issues. And he told her, good news, you don't have any of these. But that doesn't really help her because she still doesn't feel well, all right? So she's telling me at this visit she's having chronic abdominal discomfort. She's having diarrhea 6 to 8 times per day. She's feeling socially isolated. So because of the diarrhea, she's not making plans to go out and see people or engage in hobbies or go shopping. She's starting to feel depressed about this. And despite the reassurance from her gastroenterologist, she has this persistent anxiety. Something's wrong with my body. There's something bad going on. So I decided to take a dietary history, and this is what came out. So for breakfast, she would have an English muffin and coffee with coffee meat. For lunch, she'd have deli turkey on sliced bread and a diet soda. Dinner was pasta with chopped turkey and jarred sauce, and dessert was a frozen yogurt. Low-fat diet, so good, right? Oh, I'm seeing a lot of heads shaking. Okay, what's wrong with this diet? Thank you. Tons of processed food and some other problems that we'll delve into. So it took a lot of talking, but I said to her, I think you have something called dysbiosis. And just to sort of set the table for this, probably a lot of you know this, but we have something called the microbiome. It's roughly 40 trillion bacteria that live in our gut, and these are mostly healthy bacteria, and they're necessary for our health, our digestion, and for our metabolic processes. And dysbiosis is the term for when that microbiome has been disrupted. So rather than having this vibrant, diverse population of microbes, you have a much smaller and less healthy population of microbes. And I said, look, I think this is what you have. Humor me. For the next 6 weeks, I want you to eat no processed foods. I want you to eat lots of plant matter, and I want you to eat fermented foods at every meal. Okay? I didn't say you can't eat animal products if you don't want, but I want you to emphasize the plant stuff and the fermented stuff. So this is things like sauerkraut, yogurt, vegetables, beans. And when she came back 6 weeks later, completely better, okay? So I know you're all thinking a couple things right now. And the first is you're thinking, that's pretty awesome. And you're also thinking that you became physical therapists and not doctors, and you did that in partly so that you wouldn't have to hear about people's poop. I'm going to explain to you why this is relevant to what you do in a minute. Okay, so the American College of Lifestyle Medicine defines lifestyle medicine as a medical specialty that uses therapeutic lifestyle interventions as a primary modality, and I'm emphasizing that, to treat chronic conditions, including, but not limited to, cardiovascular disease, type 2 diabetes, and obesity. All right. Full disclosure, I am not at this time certified in lifestyle medicine. It's something I've long been interested in. I am studying it at the moment. But some of what I'm going to give you may differ a little bit from official discussions from the Lifestyle Medicine, American College of Lifestyle Medicine. So My definition of lifestyle medicine is basically getting people to live closer to historical human patterns so that their bodies function more optimally and they develop fewer health problems. Okay, so basically when we think about lifestyle medicine, we're thinking of this, right? Exercise, good nutrition, good sleep, not this, right? I want to emphasize I'm a medical doctor. I prescribe pills. It's a miracle that we live in a time when we have pills, procedures, surgeries, diagnostic imaging. These are all great things, but it's a tragedy that the first thing we often reach for, and often the last thing we reach for, is the pills and not this stuff. And we need to change that. So American College of Lifestyle Medicine defines 6 pillars of lifestyle medicine, which Jeff talked about in his talk, but I'm going to just review them quickly. So it's a whole food, plant-predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. And my talk is going to focus on a whole food, plant-predominant eating pattern. So I want to emphasize something really importantly, okay? That does not mean you have to be a vegan to improve your diet, okay? The topic of whether people should be vegan or not vegan is completely outside the scope of this talk. I work with patients as they are, and I think we all need to do that. So I think almost every American is going to improve their health if they eat less processed food and more plants. And if you want to include meat or dairy or eggs in your diet, that's a whole other conversation, okay? So what does this have to do with joint health? And I would say diet has at least 3 effects on joint health. The first, as we are all well aware, is that there's a physical load on the joints as a person becomes heavier. The second, and Jeff talked about this in his talk, is adipose tissue, fat cells, are in and of themselves inflammatory. And the third, and this is where my anecdote about Maria comes in, is the gut microbiome itself plays a role in musculoskeletal health. So I don't think I need to delve much into this first point, but I'm going to talk a little bit about points 2 and 3. Okay, so adipose tissue is inflammatory. Don't worry, I'm not going to make you go through this whole slide. I'm just a dumb primary care doctor. I don't like, going into the biochemical stuff either. But the point I'm going to get is, and Jeff talked about this too, adipose cells themselves are inflammatory. Okay, so that's going to put stress on the joint itself. They also are going to secrete cytokines that basically cause skeletal muscle to shrink. So a lot of patients with obesity will develop what we call sarcopenic obesity. And this is where your kind of total body weight is above normal. But if you put these people on a body scanner, they're very under-muscled. And that loss of muscle is going to further exacerbate arthritis by leading to more joint instability and malalignment. Okay. Gut microbiome, plays a role in musculoskeletal health. So this is a review from a rheumatology paper, and I'm just putting this quote up so that you'll basically believe me when I tell you microbiome has a role in health. I'm not going to go, I think it would be a very long talk to discuss the chemistry behind that, and it's not so important. But from a rheumatology review just last year, microbiome changes are strongly associated with osteoarthritis disease process and with OA risk factors. And just another slide to make me look like I know what I'm talking about. Western diet leads to dysbiosis in the gut. Again, that's a disrupted gut microbiome, which in and of itself is going to create a pro-inflammatory state. Okay, so the point is, the way we've traditionally thought about this is musculoskeletal problems or a tissue injury. So someone comes in with knee pain, they've got a sprain, arthritis, something like that. And the treatment is going to be aimed at that injury. So it's analgesics, it's anti-inflammatories, it's physical therapy, injections, surgery. The newer way to think about it, the way we need to start thinking about this, is musculoskeletal problems or a tissue injury that's interacting with systemic factors. And so everything I told you on the last slide is still an important part of our treatment. But we also have to be thinking about healthy diet, weight management, stress reduction, better sleep, and improvement of the gut microbiome as other tools to offer patients. Okay, so to summarize briefly, lifestyle medicine can improve overall health, and that does include joint and muscle health by deloading the stress on the joints, by creating a less systemic inflammation through reduced adipose tissue, and by improving the gut microbiome. Okay, so here's where this comes into you, okay? You're meeting patients at a vulnerable point, And they're coming to you because they're in pain. Maybe they're catastrophizing. They're thinking, I'm never going to get back to my job, or playing golf, or playing with my grandkids, or whatever. And they are likely to listen to you. Okay? You're not nutritionists, and I don't expect you to spend hours and hours counseling your patients on this. But since you're with them anyway, you might get asked by them, hey, what can I do? All right, you've told me I need to eat better. Maybe I need to try to lose a few pounds. What do you want me to do? So I want to arm you with some top dietary tips. Okay. We all were taught this equation, weight loss is about calories in versus calories out. To lose weight, you have to create a calorie deficit, and that's eat less and move more. And this is terrible advice to give people. It's not that it's not true, okay? But there's a couple of problems with it. One is it turns weight into a moral issue, right? You're overweight because you eat too much and you don't move enough. And it doesn't account for the fact that we basically live in a world that's been engineered to make us overeat and move less. And it doesn't give them any actual tools that will help them to eat less and move more. Okay, if you turn this into a math problem, people fail, and we know that. Something like 99% of people who try this approach, it doesn't work for, or they lose weight briefly and they gain it back. I don't want you to counsel your patients to create a calorie deficit. What I want you to do is arm them with lifestyle changes that, if they follow, are going to lead to improved health, and that will probably lead them to eat less and move more and potentially lose weight. Okay, so how do you do this? The single most important thing is get them to eliminate processed foods as much as possible from their diet. Okay, so here's a really cool study. There's a very well-respected researcher at the NIH named Kevin Hall, and this was a paper he published in 2019. He took 20 healthy volunteers who agreed to spend 14 days in a metabolic ward. So these basically are people who are like locked away, where everything they eat and do can be measured. And they were randomized to receive identical diets in terms of calories, sugar, fat, fiber, protein, carbs, etc. And the only difference between these two groups is one group was given a buffet of food that included unprocessed foods, and the other got everything in the form of processed foods. And they were just told to eat as much as you like, eat till you feel full. Anyone know the punchline of this study? Want to take a guess? Okay. The people who got the unprocessed food ate 500 fewer calories per day, and they lost weight. And remember, they were not told to eat less. They were just given unprocessed food, and they ate less. This is really important because ultra-processed foods now make up 60% or close to of the American diet. So this is a graph from a couple of years ago. Sorry, but you can see we started the century at a bit over 50%. We're now coming up on 60%. So we started the century badly, and we're getting worse. Okay, and when I talk about ultra-processed foods, I don't think any of you are going to be shocked to know that I'm talking about stuff like chips, soda, fast food, candy. But what's really insidious is how much stuff has made it into our food supply in the past few decades that looks healthy, it's even marketed as healthy, but would also fit the definition of an ultra-processed food. So we have Cheerios, it says lower cholesterol, it's part of a heart healthy diet. Nature Valley, that sounds healthy, right? Orange juice, it's got vitamin C, it's gotta be good for you, right? These are not foods that would appear in nature. They're highly removed from their original sources, and they fit the definition of an ultra-processed food. Let's just go through a couple common examples, right? Salad, that should be a healthy thing, right? We want patients to eat salad. Here's a very popular brand of salad dressing. Can you guys read the ingredient list on there? Okay, so water, fair enough. Red wine vinegar. Soybean oil, highly industrialized processed fat. Sugar, corn syrup, xanthan gum. So gums appear in lots of foods in the market. They basically provide like a fuller mouthfeel, so that's why companies like putting them in. But their studies have actually shown as these pass through your gut, they basically bind to bacteria and like rip them off the wall lining. So you're creating dysbiosis when you eat anything with gum in it. Yogurt, in theory, that should be part of a healthy diet, or could be. Here's a very popular brand of yogurt. Number 1 ingredient, cultured low-fat milk. Sounds good. Number 2 ingredient, sugar. Then strawberries, okay. And then a whole bunch of stuff that you probably need a chemistry degree to read. Hungry Man, 26 grams of protein. That sounds healthy. I challenge anyone to read that ingredient list and be able to recite it back. Okay, so I think we can give a medical definition of unprocessed foods, but the food writer Michael Pollan, to me, has given the best definition. Here's two of them he's given. I think they're both great. One, don't eat anything your great-grandmother wouldn't recognize as food. And the second is don't eat anything with more than 5 ingredients or ingredients you can't pronounce. I'm really pulling Jeff's shtick about the water-drinking comedian here. Okay, so what does that leave us, if we're going to eat unprocessed foods? Well, the list of unprocessed things would include meat, fish, eggs, dairy, and then I put in bold the rest of it because these are the plant-based things that should be the bulk of the diet. Nuts, seeds, fruits, vegetables, beans, unprocessed whole grains. Tip number 2, eat a lot of plants. Okay, so fruits, and even better than fruits, non-starchy vegetables are high in fiber, they're high in vitamins and micronutrients. They provide a lot of satiety per calorie. Okay, I challenge any of you to eat 500 calories of broccoli. None of you would have trouble eating 500 calories of pizza or donuts. Okay, plants nourish our gut microbiome. Really, really important. Here's a study from Spain. They took a look at university students, okay? Only 13% of the surveyed university students had an adequate fruit and vegetable intake. The proportion of excessive body weight in the study was 39.1% of the students. So this is concerning, right? Because these are young people. But the condition being significantly higher in men, and the risk for excess body weight was identified, the risk in those who were not consuming fruits and vegetables daily was 2 to 3 times higher than in the peers who reported adequate fruit and vegetable intake. Okay, so basically, to translate that into plain English, if you eat your fruits and vegetables in this study, you're 2 to 3 times less likely to be overweight. I keep harping on this microbiome. So this is a really crazy sounding study, but this is true. They took genetically identical human twins, where one twin is overweight and the other's a normal body weight. They took poop samples. Sorry to keep harping on the poop. They put them into identical mice. And then they fed the mice exactly the same diet, the same number of calories. And the mice that got poop from the overweight twin became overweight. And the mice that got it from the thin twin remained thin. Okay, so our gut microbiome plays a huge role in what our body habitus is going to be. Okay, and if you want a healthy gut microbiome, you have to eat lots and lots and lots of plants. Okay, tip number 3 is eat more protein, all right? This is where you start to get into nuance about completely plant-based or somewhat plant-based. You can definitely get enough protein on an entirely plant-based diet, but again, that's a topic outside of this specific talk I'm giving. Okay, so a few things about protein. Protein alters your hormones in a way that leads to greater satiety. So here's a study where they randomized, fed people either a high-protein breakfast or a high-carb breakfast without protein in it. And the people who got the high-protein breakfast had less ghrelin secretion several hours later. Ghrelin is a hormone that makes you hungry. So basically, the upshot of this study is if you have a high-protein meal, you're going to have a hormonal profile several hours later that leads to less hunger. Okay, protein has a higher thermic effect than other macronutrients. So thermic effect is basically the cost to your body of digesting food. All right, if you eat 100 calories of fat, the thermic effect of fat is, let's say, 3%. You're going to absorb 97 calories of fat and burn 3 calories in the process of that absorption. If you eat 100 calories of carbs, carbs have about a 10% thermic effect. You're going to absorb about 90 calories of carbs, and about 10% of the carbs are going to be burned up in the absorption process. For protein, that gets as high as 30%. So if you eat 100 calories of protein, you are likely going to only absorb maybe 70 to 80 calories. Protein leverage hypothesis. So these are two physiologists in Australia who've kind of come up with this theory that all animals really they have a certain amount of protein that their body needs, and they're going to eat until they reach that amount of protein. So hypothetically, if you have a potato chip that's 1 gram of protein per 100 calories of protein, per 100 calories of chip, and you need, 100 grams of protein for your body that day, you're going to eat 100 calories times 100 until you hit your protein limit. Okay, so obviously very easy to overeat on low protein foods, and that goes back to the processing, right? Most of our processed junk foods are really protein deficient. They're combinations of carbs, fats, salt, and sugar, because that's what tastes good. Protein helps maintain muscle mass, okay? Easiest way for any of you to lose weight right now would be to get a body part amputated, all right? That's not what we're going for. We're not going for weight loss. We're going for better body composition, and what that means is you want to maintain muscle mass and hopefully reduce your adipose tissue. Adequate protein intake combined with some type of resistance exercise is key to that process. Okay, tip number 4. I suggest patients try intermittent fasting. How many of you have heard of this? Yeah, everyone knows about this now, right? Basically, a lifestyle in which you limit the hours of the day for feeding opportunities. Lots and lots of styles. I don't have an endorsement of any one particular one. The most common one my patients play around with is 16-8, so they might eat from noon to 8 p.m., and then from 8 p.m. to noon the next day, they take no calories, just like water, black coffee, black tea, okay? Now, just a few months ago, CNN had this big headline, intermittent fasting may not be as helpful for losing weight as once thought, study finds, and that was referencing a study that found that if you compare people who do intermittent fasting to people who just do caloric restriction, there's no particular benefit to the intermittent fasting, and that's true. Okay, intermittent fasting does not work better for weight loss than calorie restriction. But the key part of this study is it doesn't work any worse either. Okay, again, we want our patients to eat less calories, but we don't want to make it a math problem. So how do you, quote unquote, trick people into eating less calories? One tool that helps a lot of patients is to try intermittent fasting. A lot of people just find it easier to eat fewer normal sized meals than a couple of small meals each day, right? It's not in and of itself magic. I tell patients it's not a free license. If you spend your 8 hours eating window, eating cheesecake and donuts, it's not going to work. But combined with other strategies, it can be a helpful tool. Canadian Family Physician Journal did a review of this a few years ago. They reviewed a lot of trials. They found that all 27 intermittent fasting trials that they reviewed found weight loss of between 0.8% to 13% of baseline weight, with no serious adverse events. So this is a very low-risk intervention to try. 12 studies comparing fasting to calorie restriction found equivalent results. Again, it's not better than calorie restriction, but it's not worse either. A lot of patients find it easier. And it does, in several studies, seem to improve diabetes control independent of caloric restriction. Okay, I think probably a lot of you are thinking I'm going to talk about exercise. I'm not. I think we all know exercise is good for us, but it's actually not that big of a role in body weight management. What is a really underappreciated role in body weight management is stress and sleep. So, a lot of Americans are just chronically stressed all the time. They are up at night watching Netflix, responding to emails from work, and we live in a very high stress culture. And that raises people's cortisol levels. It leads people to make poorer food choices. It's not an easy fix, but I think it should at least be on people's radars that if they're not sleeping and they are not managing stress well, it's going to set them up to have a much harder time managing their body weight. Okay, so to summarize, lifestyle medicine uses nutrition, stress management, exercise, and better sleep to improve overall health. By multiple mechanisms, this improves joint health as well as things like diabetes and obesity. It's going to create decreased load on the joints, less inflammatory cytokines, a healthier gut microbiome, and less inflammation. You are an important person in reinforcing this message for your patients, and to help eat people. That one's going to go viral. To help people eat better and lose weight, we need them to adopt lifestyle measures that lead them to eat less. And the highest yield of these, in my experience, would include avoiding processed foods, eating a wide variety of plants, making sure to get adequate protein, intermittent fasting, and managing sleep and stress. Okay, so what's my, I'm supposed to go to 12:15, 12:30? Oh my God. All right, I'm a little ahead of schedule. All right. Well, fortunately, I prepared a bonus section. So, I promise you I prepared this section, and then I decided to do a trial of this talk. I did it to my wife, and she said, do you know there's this meme going around that American men are obsessed with the Roman Empire? And I'm not on social media. I had no idea about any of this. I thought, oh, shit, okay. I'm going to talk to you about the Roman Empire. Okay, I told you earlier that lifestyle medicine, in my view, is getting people to live closer to historical human patterns so that their bodies function more optimally and they develop fewer health problems. Okay, so a personal anecdote, I was a history major in college, and then years later I went back and went to med school. I have a couple of kids, and my 10-year-old is obsessed with ancient history. So I've watched a lot of documentaries in the past year about the Greeks and the Romans. So it's my kid's fault. Okay, but here's the thing, right? I got to thinking, because, in all these documentaries, it's always about the wars, right? So this is Rome in the year 264. It's just the southern boot of Italy. That's this area. And this is the Roman Empire less than 300 years later. And it sort of struck me. I thought, how the hell did they do that, right? Like, we've got all this crazy technology that we run the world with now is in the American Empire. But all they had was this. And I got to thinking, I was like, okay, well, I don't know that every Roman soldier looked like, Brad Pitt in 300, but they must have been in decent shape. So how I got to that, it was just like, how did they train their soldiers, right? I was just curious. And I looked it up. Have any of you heard of rucking? All right, this is a popular thing right now. You put a backpack on, and you take a walk. 2,000 years ago, this is how the Romans trained their army, all right? If someone signed up to join the Roman army, they would get a 45-pound bag, they'd put it on their back, and they would be made to march. Now, they got a little, sword training and stuff. But basically, they just marched all damn day long with a 45-pound sack on their back. And at the end of 4 months of this, they were expected to be able to cover, I think it's 18 miles in 4.5 hours or something, with a 45-pound bag on their back. And if they did it, they were in. They were a soldier. I thought that's kind of cool, right? Because everyone these days, when I talk to them about getting in shape, they're like, I got a Peloton, I got a gym membership, I got a kettlebell. Simplicity applied consistently works for getting people into shape, right? But have your bag on your back and take a walk every day, and you'll be in much better shape than the average person. Okay, and then I got to thinking, well, what other health habits did the Romans have? Well, turns out most Romans were poor and couldn't afford meat, so they largely ate a plant-based diet, right? Vegetables, beans, a little bit of eggs and fish, a lot of olive oil. They ate a lot of fermented foods. Red wine, by the way, is a fermented food, so you can all celebrate. So is cheese, authentic sourdough bread, the way they used to make it, and olives. So some of my favorite foods. The Romans typically ate a light snack in the morning and maybe another at midday, but only one big meal a day. Anyone who speaks Spanish? Cenar. It's the verb for have dinner, right? Comes from Rome. The siesta is thought to have originally originated in ancient Rome. Okay, community was a big deal in the Roman Empire. They had strong family ties. They were obviously a very different religious society than religions practiced today, but they were historically pretty religious. Communal baths and saunas all over the Roman Empire where people would go and hang out. Best I could find, and I can't get a source for this, but they didn't have Netflix, Facebook, or Twitter. And you're probably thinking, well, so what? The Romans, didn't they have short, nasty lives? And yes, they largely did. Okay, life expectancy in the Roman Empire was something like 30 years. But why did they die? As in all pre-modern societies, for women, giving birth to a child was extremely dangerous. Okay, infections. Something like half of Roman children never made it to the age of 10 due to things like strep throat, pneumonia, diphtheria. Trauma. Okay, lots of Romans were slaves, soldiers. They were worked to death. Malnutrition was common, okay? Now, the diseases we suffer from did exist in the Roman Empire. They wrote extensively. And by ancient standards, they had a somewhat sophisticated understanding of medicine. And so things like cancer, diabetes, heart disease did exist, and they were described, but they seem to have been pretty rare. And, that 30-year thing is an average. So a lot of people died very young. A fair amount of them lived into their 70s, 80s, and 90s, okay? The point I want to get at is this. I think we can have the best of both worlds. So our world of antibiotics, vaccines, clean drinking water, adequate nutrition, safe obstetrical care, modern medical care, But it's good to get back, and the Romans are not unique. I'm just talking about any sort of pre-industrialized society, back to the things that humans traditionally did, which is lots of plants, lots of unprocessed foods, fermented foods, maybe some fasting, regular physical activity, less stress, more sleep, community connections. And I think if we do that, then we can have the best of both worlds, and hopefully you and your patients will have great health. So thank you very much for your time.
Speak to your book selection, and I'll give you the
Okay, sure. Okay. So the book I selected is called You Can't Screw This Up by Adam Bornstein. And I think it's a kind of fairly non-judgmental, helpful, good toolkit for kind of weight loss. So if a patient of yours is looking to lose weight, this is a book you might recommend to them. And very importantly, he agrees with a lot of the things I just told you. So that's mainly why I picked it.